happening behind those headlines that we see out there. And we are going to be looking at, there are so many stories that have been, that have, news that have happened. And we are going to have a guest. We are going to have a number of topics to touch on. We are going to be looking at, briefly looking at the mayhem, if you want to call it, going on in South Africa already. 72 people have been reported dead out of the riots, the demonstrations, the madness on the streets, the outright looting of property, looting out an entire supermarket, and huge as they may be. We are going to be looking at that and see are there lessons to learn from that. But we shall also be touching briefly, if we have time, on the huge story, not big really, but very interesting, though sad story. Uganda Airlines reports that while in Dar es Salaam, flight UR 321 belonging to Uganda Airlines running short of fuel. Extremely sad, but did it happen? Yes, we have a report from the official report, and we will be touching on that briefly. We will also be touching on the postponement or pushing of the deadline for sending money to the vulnerable across the country. Today was supposed to be a deadline, and we had anticipated that we would be hosting someone from the Prime Minister's office or from Ministry of Gender to discuss the details of these handouts, or whatever you want to call it, but the relief money, 100,000 shillings being given to the vulnerable across the cities, the municipalities across Uganda. But we can't discuss that with the officials because the deadline has been pushed to probably Friday this week or later, because verification of some data, especially those from within Kampala, is still going on. So the process cannot be finalized. But we will also be giving you an update of COVID-19, especially the lockdown. Today is day 26, meaning that we are left with, is it 16 days to wind up the lockdown. Everybody is looking forward to that. Nobody wants to entertain even a dream of a possibility of more extension from the 42 days. People are literally counting down the days and the number of days left. 16 to go. And we will be talking to Dr. Monica Musenero, who is now the Minister in charge of Science, Technology and Innovation in the Office of the President. And she is an epidemiologist, and we shall be chatting with her and asking her what has been achieved so far in the last 26 days of the lockdown. I hope she is now online to discuss all these issues. We will have her. We will also have our usual panelists. We have in the studio Council Sarah Birete, who is the Executive Director of the Center for Constitutional Governance. Sarah, you're most welcome back to the show.
Thank you, Charles, and good evening, viewers.
Good to have you back and to know that you're surviving COVID well. I must admit, Gobi, you were not around last show. One of our viewers sent me a message warning me that, Charles, be careful. You don't appreciate that Sarah is very smart on the show, and don't think that it is easy to be smart on a show like this. So I have to say, Sarah, thanks for being smart. I don't want problems with your fans and my viewers.
That's wonderful feedback. To be smart in a mask.
I know.
It's not easy.
No, know, at least I'm lucky they didn't say she smiles a lot, because next on my left and in the middle here is Professor Ramadhan Gobi. He is a panelist on this show and an economist, and he teaches political economy at the Makerere University Business School in Nakawa. You're most welcome back to the studio today.
Thank you very much, Charles. Good evening, the viewers, and Sarah.
Good.
Professor.
let me start by finding out whether, because we need to start with the COVID so that we can allow Doctor to take leave once we have finished with that, because then we shall be moving to other topics after the... Yes, there Doctor is. Doctor, good evening.
Good evening. How are you?
I'm doing fine, and the panel here is fully constituted, and we are all fine. How are you keeping, Doctor?
Oh, I'm keeping fine. My greetings to Ramadan and Sarah.
Good evening, Doctor.
Thanks a lot, Doctor. I want to start by congratulating you. Now you are a minister, no mean achievement. You have worked for it. By your effective delivery, you have been a presidential advisor on health-related matters. And of course, for many people who are not so much in the news, they got to know you when COVID became COVID in March last year, especially when you sprang to national popularity. And now you are a full minister in the cabinet of Uganda. We want to congratulate you and thank God for that. And we pray that that you serve
Thank
well.
you so much.
Thanks. So, Doctor, we are going to start with you for, say, about 30 minutes or so, and because then we will be going into other topics which I don't want to hold you to be part of. You may be bored. You scientists get easily bored with Lugambo. So I want to... So I will keep you here for the COVID updates. Let me start by asking you, 26 days today. I know that you have been one of those who have been who pushed that we need to take a hard stance against COVID. No jokes with this virus. Let's lock down and do work. What do you think, and how much has been achieved so far in these 26 days?
Well, thank you so much. And first of all, it's not an easy decision to advise that you lock down. It's also not easy to convince the people who make the decision, but I think now we know that we took the right decision. We've been able to reverse, we call it bending the curve. We have been able to bend the curve back, because when we went for the lockdown, the cases were very high. They were growing very fast. We were doubling cases in two days, 3 days. Of course, it didn't take long. The hospitals were full. And then the stories that we have heard, funeral services were not available. People were suffering with huge bills in the private hospitals because the government hospitals were full. But I am really glad to see the outcome, because when you make a decision like that and advise like that, you are behaving like a prophet. You saw those prophets of the old, and it is only time which tells whether you were right. Whereas we use a lot of knowledge and science and skill to make those decisions, this time Even I remember His Excellency was like, this is Msenero. And I'm glad that although having a lockdown is not simple, but I'm glad to begin to see the relief on the healthcare system. And of course, that means that we are really saving some lives. We are saving lives. And we now have hope. Sometimes you can refuse to take a hard line of action, but then this COVID would just continue, and anyway, at some point you would have lockdown, because there is no way you can continue with those massive numbers of deaths. So I'm so glad now to see the results that we are having fewer numbers, we are having fewer deaths. We have actually now started discussing what should come after this. How should things be after this? So that for me, I'm kind of gratified that we've contributed to the saving of lives, and to see it respond so quickly that we may not have need to extend, but that will depend on how the population acts in the remaining days of the lockdown.
Doctor, I got some reports of from hospitals. I know one hospital which was taking in about between 40 to 50 people every day, and that the numbers have gone down to almost 5 to 10, between 5 to 10. I saw at Nambole, the beds are now being freed. Several beds actually now free. At Mulago, there are reports that many of the beds are now free. At other health health facilities as well, many around town, a very fast scan yesterday and today showed that many of the beds have been freed, especially the intensive care and high, what do they call it? The high facility
dependency unit.
High dependency unit, the HDUs. Is that enough reason to celebrate so far or thus far? Or is it too early to do that?
Thank you. It's both. It is a reason to celebrate because it's a good indicator. It means that the epidemic is responding to our interventions. But it is also too early because the continuity of that depends on how we behave now, because this disease spreads based on how we act. We are the ones who carry the virus. So it is not a permanent situation. So the message we take from this situation is that what have we done to bend the curve? Of course, there is staying home, there is keeping people away from crowded places, there is stopping people from moving, but those are only measures, means to an end. The real thing is people staying separated, and we can do that voluntarily without a lockdown. It is people wearing their masks, and we could do that without anybody forcing us to do. It is because we stopped public transport, but we could have kept public transport and kept the SOPs so that it is not a major means of distributing the virus. So how we behave, if people, it is those things. If people stop now and say, oh, cases are going down, now so we can always go back, we can start to gather, we can stop wearing the masks, then this curve can rise very sharply again. Because we still have cases, meaning the virus is still distributed there. So it is both yes and too early to celebrate.
Doctor, what do you think should be the behavior of the people in the next 2 weeks especially to to ensure that the bending of the curve continues more downward for the better in the next 16 days that is left? What behavior of the ordinary person do you want to teach us about?
Thank you. Most people, when we put a lockdown, many people look at it as Musenero's thing or the president's thing. And there's a heavy enforcement because people are not volunteering. Now, in the remaining days, I would request that we own the measures. We own the measures. Don't put on a mask because you're going to see a policeman. Let it become your thing, your contribution to COVID control. The social distancing, the not gathering, not going for funerals, not visiting people, the sanitizing. So that behavior now should become a personal decision, because should we open and behavior changes, you'll see in many countries, they are in and out of lockdown. But ideally, we should be able to live with this disease. We should be able, if we own the control measures, because the issue is not that the virus will go away. The issue is that the virus should not overwhelm the healthcare system. Like now, you will see that even when cases keep coming up, the death rate is going to become very low because people are able to access the care and they don't deteriorate. So what I ask and request every single Ugandan, every single citizen in these boundaries of Uganda is, let's own. Let me own the response. Let me own my own measures, the SOPs, so that you don't need anybody. You see, some of the drivers of this surge were really avoidable things. One, why we lost a lot of younger men and young women compared to the previous one is because their colleagues were hiding at night and going to bars. So then they infected their colleagues in the office. Drivers of these officers in government, they were the ones who infected most of their bosses. So if we can say, okay, even if I need to drink my beer, can I buy it and take it home? And I just don't do this because it's not just dangerous to you, it's dangerous to your family. You know, at the beginning of this wave, it was so sad. You'd go to Mulago and see 6-year-olds, they're really struggling to breathe because they had been infected by their careless parents or by a parent who has been infected by careless someone. So once we have understood the chain of how the virus moves and each person takes responsibility, I can assure you we can live with this virus without a lockdown.
And I'm going to, 2 more questions, then I'm going to ask my colleagues here, Sarah and Ramadan, to also interact with you on some of the pertinent issues. But I wanted to make a follow-up. You said that it's not that the virus will go away. And then you added that we can actually live with it. Is that an early indication that even after this lockdown, there needs to be some other behavior, dynamics that people have to follow, and to know that actually COVID will not go away from us right now, but that we have to start learning how to live with it? And what are some of those things that beyond the 42 days that people must begin to learn how to do now in preparation for learning how to live with it?
Yes, until we have vaccinated enough people in the country to achieve what we call herd immunity, we are going to be in a game of hide and seek with COVID. At the moment, we have vaccinated so few people that the virus can still walk through the entire population. It can walk through us, infecting many people. We can still overwhelm the healthcare system. So yes, the virus is still going to be with us, even when we vaccinate, except that it will have few people to make very sick. So we must keep the SOPs. That's the same things, not very difficult things. Keep your distance. Just keep your distance from other people. That means, in practical terms, avoid gatherings, avoid visits, avoid just going to any gathering. Personally, I just don't go to any gathering. I don't attend weddings. I don't attend introductions. I don't attend funerals. The other day I lost my mother and I was telling people don't come because it is just going to make other people risk their lives. Visiting relatives is not a gift to them now. Send mobile money. So the change in behavior that we just know that we are not supposed to be in groups, especially with the people whom we don't normally live with. The second thing is to adopt the mask. The face mask must become part and parcel of your daily wear. It's like your trouser. You don't move out of your house without it. It is like so we adopt the mask as we accept it, and moreover get a proper one. Up to now, I see people wearing masks with their noses leaking out. You see, by now we should really understand that it is covering those two holes, especially covering the nostrils and covering the mouth. Then we learn to obsessively wash your hands. Carry your little piece of soap, any soap works. And when you reach somewhere, just see water, wash your hands. Even when you're entering those buildings, make sure you wash your hands. So if you can keep your distance, wear your mask, wash your hands. Each one of us needs to personalize those things. And if enough of us can do it, we can keep COVID at bay. Of course, from the government side, we are working to see that we get vaccine. Unfortunately, we are not in control of the vaccine manufacturing. If we are making it in our country to be possible, so all we are doing is making a lot of effort to make sure that we are able to secure vaccines and vaccinate. But still, it's going to take us a few months. Even if we got vaccine today, it will take us a number of months to build up that immunity. But if we are careful, if each one of us and as many of us observe the rules, if I run a taxi business, I'm going to put in very few people, insist they are wearing their mask, insist that they sanitize or wash their hands. If we make those efforts, we will keep the cases low. The virus is here. The moment we break those laws, the moment we break those practices, it just starts rising. And it is just a matter of time. You'll just begin to see it. And you will be forced to go back again into the unpleasant lockdown. So we needed to prepare for that and accept and change our minds and live consciously that we need to protect ourselves and protect other people.
Finally, from me for now, you mentioned the issue of the vaccine, and you are talking about the entire management. Parliament has just today, given a good support by appropriating 1.3 trillion shillings to the management and the fight against COVID-19 in the next few months. Of course, the issue of finance, the issue of the costs come in when you are talking about managing COVID. Is this a good a good symbol by the legislative arm of government that we want to fight this completely out of our country. Do you think that that is money that can go a long way in curtailing the spread? What do you think about that?
Of course, that's a very positive sign. It's a very good sign because at some point there didn't seem to be understanding about the cost of fighting a pandemic like this one. It is extremely expensive, and in a way, I like the way the hospital charges in private facilities have brought
Doctor, have I lost you? I think we have lost the network to Doctor, but the technical team is trying to reconnect her back into the studio. Let me come back to us here. Sarah, as we wait for Doctor to come back and we engage her more, but we were at the stage where we were now touching on the money. Parliament has today appropriated 1.3 trillion shillings. Of course, this is about, I think they needed, the Ministry of Health had asked for, is it 1.7 or 1.8? But money is always a scarce commodity, a scarce resource. And however pressing the need is, sometimes you don't get the entire request that you make, especially dealing with money. Do you think that this is a good support to the health sector to continue the fight against COVID? Will this, in your view, get for us the vaccine? Will it get for us the issues sorted out? Sarah, starting with you.
Yeah, thank you, Charles. Of course, the Ministry of Health needs money to push back against the severe effects of the pandemic. They need money for testing, they need money for essential drugs, they need money for the frontliners, the medical workers, as well as the vaccines. We have unfortunately had, the first phase of COVID. The performance by the Ministry of Health and what is in public domain, unfortunately, is not good and encouraging. And I hope that this time round, Parliament will do their proper oversight function to ensure that this money does what it's intended to do. We have, if you look at the COVID task force findings so far, they have been in the regions. Every main referral hospital, there are gaps in oxygen, gaps, absence of essential drugs, doctors are unpaid. Yet in the first phase, we spent, didn't we reach up to 11 trillion? Ramadan is better on figures.
No, we didn't. I think it was
For
about,
COVID.
is it 3?
I know the Minister of Finance contradicted himself. He said 4.3, and yet the Auditor General's report says 5.7 trillion. But I hope that the gaps in accountability will this time be addressed. We hope that the essential things required for COVID will be procured, and most importantly, we all know how really other countries have regained their lives back, vaccination. So treatment can be only for containment. Once we do not vaccinate, like Dr. Msenero was saying, I think our target is 21.9 million, and we have so far vaccinated only 1 million. So we have the whole of 21 million people to vaccinate. So once we don't make clear steps to ensure that the 21 million population are vaccinated, we shall still be here with this pandemic. So I think Parliament needs to approve more money specifically for vaccination to ensure that this target group is covered.
Ramadan, do you think that the 26 days from your following of events and from some of the issues that Dr. Musenero is sharing with us, has the 26 days so far yielded something tangible for us, even from an economic point of view?
Always you will bring in the economics.
That is where there is a
I know.
livelihood.
Number one, I think, yes, the few days we've spent in lockdown have kind of made Ugandans realize that COVID is real again. Like last time when we were in lockdown, everybody seemed to understand that COVID is real and it's killing people. Everybody is receiving information, is receiving news here in the urban areas in Kampala and other cities where people have access to social media, and they are relying a lot on it. They are getting a lot of information because when we are home, the only thing we are doing is watching TV, reading papers, if you can access one. But most importantly, people are clicking their phones and they are getting a lot of information. Most of it is actually misinformation, but I think it has also scared many people. And they are realizing that COVID is killing and it is real. So that has helped to reduce on the movement of people visiting friends, going to parties and so on. So the speed at which the virus was spreading has reduced, definitely. You don't need to be a genius or a scientist or someone with the data to see that. Two, I think also, I don't want to rely a lot though on the numbers which are being now given in terms of testing and what they are finding from the numbers which are tested. Why? I have a feeling that many people who have this virus, as long as they are not very sick, they are not getting out of their homes. They are just getting self-medication. And therefore, this may reduce the rate at which people are going to be tested. Unlike before, when they were going out and whenever they felt symptoms, they go and get tested. Now, I think they have gotten more information on how they can manage the disease. So many people are buying these medicines because I see more queues at my pharmacy near my home there. Whenever I'm walking around or running around the hill, I see people lining up for medicine on the pharmacy. And many of them don't have any prescription. They are just lining up. They go and they get medicine. Then there is this craze which has come of Covidex. It's called Covidex. I've heard so many people complaining that now the price is too high. So many people are buying it without any medical kind of guidance. They just go and say, give me 4. They say this Covidex is the game changer. So they are getting the Covidex, put home. Others are still using a lot of these other herbs and these immunity boosters. So you will find that I feel if they carried out home by home testing campaign, the numbers would be higher than what these numbers we are getting now are concerned. So I wouldn't want to just celebrate now, like Dr. Musenero has said. There's still a long way to go as far as that is concerned. But to me, like Sal has said, Charles, the game changer in COVID is going to be vaccination. And I don't think that requires now any more emphasis, because we have seen the most devastated areas in the world, Europe and America, North America, they have reopened. And many of them actually, you saw the numbers in this Euro finals in Wembley.
Yeah.
It was full.
It was massive.
60,000 plus
Yeah.
people without masks.
Yeah.
That means they have gone back to almost their normal lives because they have achieved that so-called herd immunity because of the numbers they vaccinated. We are unfortunate in Africa, like the president said, and all these scientists have been telling us, we are the last in the queue of getting the vaccines. So the money is not necessarily an answer. There are so many other things which we need to do. But also I understand the countries which queued up faster,
Yeah, they are good.
earlier,
Yes.
they are getting more, vaccines, and some have covered almost half of their population. Of course, those with the smaller populations, and they have already bought the vaccines. They are now just administering the vaccines, and within no time you might find they don't require these other SOPs which we are having and the lockdowns.
Okay.
But lastly, Charles, there is this onslaught on the health sector. The narrative now, which has been put across, is that the resources we have given to the health sector to fight COVID have been stolen. I don't know whether that narrative is fully correct. Often I'm one person who, and these lawyers are the ones who advance this, who believes in natural justice. When you condemn people as thieves, before you have gone through the full circle of accountability in terms of results, beyond even paper accountability, because in this country, they love more paper accountability than results. You would rather count on paper that all this money I spent it, and there are no results on the ground. Then there are those who will show you the results they have done, but perhaps they didn't procure according to the paper, to the PPDA and so on, and that person is a thief. There is I'm not here to defend the Ministry of Health and all those other sector people, but I would want really the people who especially have power to influence public opinion, not to just allege and blow out of context, because everybody on the street out there, when you hear people talking, the people in health have stolen all of the money which we gave them and so on. And I don't think that is right. I saw even in Parliament the same thing was being raised, and I hope at the end of the day we need a clear accountability mechanism where perhaps we shall have we call them commissions of inquiry. We need to inquire every penny which we gave to the sector. If really we find anyone who stole money meant for treating or vaccinating Ugandans, such a person needs to be not even in our jails, need to be hanged, because the people of Uganda have spent 2 years either in lockdown or without livelihood, or others burying their loved ones because of COVID-19.
Yeah.
And I know in this country we have corruption, but let us be systematic in the way we demand accountability so that we don't demoralize those who are supposed to help us fight the pandemic.
Okay, thank you so much. I am made to know that Dr. Musenero is back online. Doctor, I took the discussion away from you and handed it to the panel here, and I'm sure you heard the discussions they have been having here. There are a number of comments coming from the viewers out there. I want to now take time to share some of them with you and with the panel, so that then when I come back to you, we should be winding up and concluding on this topic. Someone called Grant Bliss says, It's true we have been able to bend the curve that was previously shooting high, thanks to the efforts of the government and the citizens that are vigilant. The bottom line for all this mess is mass vaccination and observing SOPs. Aburek Eric Ongodia says government is not prepared for emergencies like COVID-19, which has been here for a year plus, close to a month, and no relief package for Ugandans. Aburek, I think I disagree with you. Several people have already confirmed receiving that. So you probably need to update your information, Eric, so that, but thanks for giving this. And he says, the president is surrounded by, he says, dwarfs who cannot help him make quick decisions. Again, Eric, one of the persons surrounding the president is the minister who is here with us, and she belongs to the scientific committee that advised the president, and the update he has just given us. So again, I think you need to update your information and knowledge on that fact, Eric, but thanks for sharing your views here. Aijuka Luke says, Charles, much as people oppose the government, but on this we should credit government and frontline workers, though some opposition people were saying the government has failed to handle COVID. But tell me, any country that is registering success like Uganda in the East African region. A call, John Bosco says they should include sociologists and psychologists to the task force to advise the president on the impact of lockdown on social and mental spheres of life. Dr. Monica, probably when I call you to respond, maybe you need to assure Ugandans like John Bosco Akol, the composition of the scientific committee. I think that's what his concern is. Mike Okua says the so-called essential sectors are contributing. No, the so-called non-essential sectors contribute to the national coffers, yet they are not allowed to operate. At some point, and hopefully it won't be too late, you will need their taxes to finance the essential workers and activities. I think Mike is not happy, but Mike, there is a good reason we have been told why the lockdown was called for or was advised through the president. It's for our safety. Zigo, his full name is Zigomba. He says 20 days in and counting, and many haven't yet received a call from Nabanja or cash for Nabanja. I am sure Honorable Nabanja is listening. She watches this program very much, so I'm sure she and her staff are definitely listening, and they need to respond to some of this. Segai Herbert says COVID relief fund was a waste of taxpayers' money, misdirected to wrong people at the expense of strengthening health systems. Segai thinks that the poor should not, the vulnerable should not have been sent this money, that it should have gone to other things. Juka, I think this one, made a comment earlier, but I think he added another. He says, Charles, always provide Mr. Gobi ample time to explain, because some people are there criticizing government without critical analysis. Gobi, you have a strong force there behind you. And then there is another one. No, I think all this we have already got. But there are some who sent on direct to my phone, like Nixon. He says, Charles, how do they, Doctor, this is direct to you. Someone called Nixon is saying that how do you know that cases are reducing, yet people are locked in their houses and not moving? What new things has government done that will help and protect people after the lockdown from getting COVID if they have not yet been vaccinated? That is Nixon. And then Lucas from Kasese. Lucas, you have to shorten your message. I cannot read long messages and when there are too many and separated. Just send one sentence, short and to the point, so that I can just read it easily. He says, I will read one of them. He says, thanks to doctor's narrative, it is very possible, therefore, that we can now live friendlier and or scientifically with COVID. That's what he says. And the rest, kindly send in your message through Twitter or the other platforms, platform contacts that we have got. We shall be reading them, and as you join in the discussion. Dr. Monica, I want to bring you back to respond to some of these issues that have just been raised, but also to respond to the issues that Ramadan and Sarah raised, and then we wind up on that topic, and we can then retire you this evening. Doctor.
Thank you so much. The internet is still weak, but I'll do my best. I hope you can hear me. I would like to thank all those who are listening, and I've taken time to follow the presentation, to follow the program. It's important that people express their views, because that's an indicator that they are listening. I would like to begin with the fund issue. I think Ramadan did a good job talking about that. The money, especially the money for COVID. Outbreaks by nature are extremely expensive. Very, very expensive. Prevention is better. COVID is a global disease, and actually some countries have had very severe lockdowns. A few Ugandans sometimes want to make it appear a Ugandan problem, but COVID is a global problem. We are just trying, we are all victims, and we just have to balance so that we can survive. That's why we don't lock down permanently. We just use lockdown to push that curve down so that we can manage the cases until we are able to get a vaccine. So the one who said the president is surrounded by dwarfs, somebody said a statement earlier this year, said everybody is entitled to their opinion, but you are not entitled to your own facts. So if the facts speak that people are dwarfs, the rest of the people know. As far as I'm concerned, Uganda is among the countries that have been able to handle COVID very well. We have had very difficult issues with countries. Some chose lockdown for a very long time. Other countries chose to ignore COVID. And of course, it has expressed itself. But we have told a middle line, using scientific evidence, balancing everything, and educating our policymakers so that they are informed very, very well. And I'm very, very proud of the scientific committee. It takes a lot of time and a lot of balancing, a lot of research for us to make any decision. So I'm really proud of the scientists and the work that they have done. Now, there is an issue, and also I think Ramadan alluded to, in an epidemic like this, there comes a time when it is technically impossible for you to really get the total number of cases. So we have methods that we use to be able to make decisions. Because when a COVID outbreak has reached what we call stage 4, that's the stage of uncontrolled spread. What we are now interested in is the trend, not really the absolute number of cases. Of course, if you tested COVID cases as a whole, you'll get very, very many. But we have indicators. For example, no matter how many numbers we have, there will always be a percentage that shows up at the health facilities. There will be people who will be sick enough to come to the health center. And right now we are confident that cases have reduced because the number reaching health centers who are sick enough to go to the health centers is in direct proportion to the number getting sick. So when you see your numbers in the hospital dropping, it means that the numbers out there have also dropped. We also have other indicators we use, like a positivity rates. The people among, when I test 100 people, how many test positive? That shows us that the rate of infection in the population. So you're kind of taking the small number of people whom you are seeing as a sample. So we have indicators that we use. There are stages of the epidemic where we are watching even a single case even, but there's a stage at which the mass testing is competing with treatment. It is competing with able to offer care. So you test people who come, we test only those who have symptoms, and there are formula that will help us. There are also systems to help us estimate the number of dead in our population, even when not everybody was confirmed. So we will apply those methods. People who are locked away, when they get sick, when they get very sick, they will show up at the health facility. We have all seen. People went to all sorts of health facilities. Even health center to COVID patients went there. Even those neighborhood private clinics, people went there and they were eventually referred. They eventually needed oxygen. So even though there are still COVID cases, and they are there and there are very many, the trend is that the cases are going down, and that's a good indicator for us. So I agree we can live scientifically. Of course, the assured way now we know is to have everybody vaccinated, and we are working towards that. But where we are still on our way, the best thing we have now is these simple SOPs. Those simple SOPs. Lastly, I would like to really commend the Ugandans. As I said, we never pretend that the measures are simple, that they don't hurt people. It's a matter of trying to weigh. If we did not lock down, we could have reached a point where people would start dying on the streets as they are trying to look for oxygen. And we had actually started seeing some few people dying before they reach. So right now we have a little bit of relief. Let's seek information. It is amazing that Ugandans have a lot of information, but they selectively pick the negative information. If we get to know the core facts and regulate our lives and get the true information, Information is power. So I would like to thank everybody for listening. We are definitely upbeat, we are hopeful, and if we keep cooperating, if we keep working on this, we will break the transmission chains and we will have our lives back. Thank you, Charles. I request that you release me. I'm really exhausted. My colleagues will discuss.
Doctor, I just want to ask you one question which has come from someone called Levi Eyaro, and he is saying, what are you, Dr. Musenero, what are you going to do about those who are preaching against the vaccination? And I want that to be the last question that you deal with so that we release you.
The first thing we do about people who oppose vaccination is to give the population the right information. And really, everybody has buried a relative or knows someone who has lost a relative to COVID. I don't think that we need to belabor that. But it is criminal in Uganda to speak against public health measures, because there is an instrument signed by the Minister of Health. If you go about preaching against, then it is criminal, because you may not believe it, you may not want it, you may refuse. It is voluntary up to now for you to get vaccinated, but it is not right for you to address the public and speak against a public health intervention which will save their lives. So first, let Ugandans know the truth, and we will avail the truth. That is why even when we are tired, like I am here, I come and try to speak and try to give people information that is necessary. I have personally, I was lucky, I'm among the healthcare workers, so I took my 2 doses. I'm okay. I took it in public, both doses, so people know that I took it, and I am still here. At the moment, it is the vaccine which is the hope. So I really, anybody who cares about people should encourage their friends, or the worst they can do is keep quiet. If they don't support the vaccine, then just shut up and let people make their own decisions. Don't be the one to cause the death of many.
Thank you so much. Thank you so much, Dr. Musenero. And we really appreciate your time. And thanks a lot for always being available to us to share your vast knowledge on this subject, and for trying, very hard to save the lives of our people of Ugandans. We wish you the best. And pole sana, of course, for the loss of your mom recently, and we pray for her soul. But we pray more for you to have, stronger endurance of that loss. So thanks a lot, and we shall release you. After the break, we will go into Wolokoso here, and wish you luck.
Okay, I wish you good Wolokoso. Greetings to Sarah and Ramadan. As much as I'm...
Let's take that break now.
Uganda.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Central Points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.
COVID-19. Chijjakugwa. If we get vaccinated now, observe social distancing, wear a mask properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
The Universal Periodic Review, UPR, is a mechanism under the United Nations where member states review each other's human rights situation every 4 years. It's a voluntary process where all states are treated as equal partners.
The ultimate aim of the UPR is to improve on the human rights situation in all countries through technical assistance and cooperation.
The UPR is a state-driven process, and as such, the preparation of the report is done by an interministerial committee on human rights that is chaired by Foreign Affairs. We value stakeholder input in the process and therefore appreciate the role of civil society in the third cycle of the UPR process.
To this effect, the National Coalition of Human Rights Defenders Uganda, a civil society organization, is coordinating all civil society organizations to participate in this process of the alternative reporting in liaison with the Ministry of Foreign Affairs, Uganda.
Man, guess what happened yesterday? I entered the what? The taxi. But the pregnancy is from the what? The generator. Then my phone does toot, and the toothbrush breaks in the what? In the porridge. Then I call home.
Wait, what?
First wait, I am still telling you. Then the jerrycan does what?
Love to talk? MTN My Paka Paka now has more minutes. Get My Paka Paka voice bundles to talk and talk at no extra charge. Dial *160*1# to activate My Paka Paka.
Everywhere you go, MTN.
Welcome back from that break, and we've just had a discussion, a great one in my view, very informative, educative, and very important for sensitizing our people on COVID and the issues around COVID. My name is Charlse Odongotho, and we are here on Behind the Headlines here on UBC. Today is July 14th. 2021. It's a Wednesday, and we are looking at the major stories of the week. Of course, COVID happens to, always occupy the major space or spaces and airtime as the leading news being discussed. We have had Dr. Musenero Monica, who is now the Minister in charge of Science, Technology and Innovation in the Office of the President. And she has taken leave, and we are now with Council Sarah Birete of Center for Constitutional Governance and Ramadan Gobi. Honorable Margaret Muhanga, as we were supposed to have her on Zoom. She is now a minister in Ministry of Health in charge of primary health care, but we shall understand if she is still finding space. When you join a new office, you need to find space in a corner where you can fit well. So Honorable Margaret, like you promised, you remain a panelist on this show, and forever, a panelist here. We hope that next week you will have been inducted so that you can come back to the show, because especially when we discuss COVID, this is your area now. You are a resident analyst for us here. Now, let's start with South Africa. You have seen the kind of mess, the kind of mayhem that has been visited by ordinary South Africans on their fellow citizens who are especially business persons, you know. One of the messages being shared, I saw one here where someone is saying every single store in the Jabulani Mall near Johannesburg has been looted, with the exception of a bookshop. And then the person says, Malcolm X once said, if you want to hide something from a Negro, put it in a book. We are not discussing that, but we are discussing this mayhem in South Africa. What are the lessons really? Starting with, let me start with you, Ramadan.
Lessons are many. Number one, I think South Africa, first of all, teaches the world that it's a mistake to jail an immediate former head of state. I know that's very controversial, but it's lesson number one.
I'm actually angry.
I know. It is
I wish I had started with Sarah.
It is always, no, let me tell you the truth.
Okay, go for it.
You know me, I'm a realist.
Yeah.
You know, in pragmatism, they say, look at things with this prism. Will I succeed in doing them? And that chance of success should be calculated. Zuma, the former president, had his own, challenges. But to put him in jail by the person he handed over, I mean, when he's still in power, that very person might not be the very one who put him in jail.
To me, Ramaphosa.
I think it was something which was not thought through very, very well. Because South Africa is always looking for a spark. Those people who are looting, of course, they are not looting because they are supporters of Zuma. They are not on the streets because they are too much loving Zuma. They were looking for that spark. And the spark presented itself in that jailing of a head of state. Why? Because a head of state, you know, when you were number one in the country, the fountain of honor, you have people whom you have touched their lives, and it becomes very difficult sometimes to convince them that that person is wrong. So it has to take time. That's why you see many countries, look at the United States of America. All of these presidents, you see George Bush, and they have committed crimes against humanity. But they protect them very, very much. There are those who say, why isn't Bush in jail for having destroyed the Middle East on wrong intelligence or in fabricated intelligence? You will never find Americans, even if they are competing politically, Democrats versus Republicans, and the Democrat is in power, will not get a president and put him in jail. So we have seen all those gates, you know, for them they call them gates. This gate, that gate, and the other gate. But you never, a former head of state is difficult to imprison. There are countries in Africa which have put them in jail, but let me tell you, when you go and you do trend analysis, they have never recovered from those mistakes. That's number one. Now, coming to the real issues, the spark which was created leading to this looting, burning of, I was watching news this morning, and I saw there was a helicopter hovering over KwaZulu-Natal, and they reported the burning down of one of the largest chemical industries in Africa, a fertilizer industry, burnt down this morning in South Africa. Why is this? I think there is this narrative that Africa is rising. You remember Africa Rising? It's a narrative which became so popular, but it failed to be interrogated. Who's rising? Rising for whom? And by who? South Africa is the laboratory to test all of the issues concerning the Africa Rising paradigm. South Africa is the most unequal society in the world. It's the champion of inequality. That in South Africa, you know, economists, we use what we call a Gini index or Gini coefficient to measure inequality. It ranges between 0 and 1. 0 represents perfect equality, 1 perfect inequality. Now, in South Africa, the Gini coefficient during apartheid was 72% or 0.72 in 1993. Today, as we speak, it is 0.65.
It has only improved by
it has
only
reduced,
7.
but a very small percentage. After years of celebration of Nelson Mandela and all of these other aspects to which I've gone with it. Now, some people, they are just hearing a number, 0.65. What is that? I can illustrate it this way. The 10 out of 100 South Africans who are the richest, the 10 richest South Africans, they are taking home 65%
of the entire wealth.
Of the entire wealth of South Africa. You get it?
And that's huge. It is
that's massive. It's the huge. It's
really.
South
Africa is the second biggest economy in Africa.
Yeah. It is too bad in South Africa that now we are talking of income inequality. When it comes to wealth, inequality in wealth, because income is just a flow. Money comes to you, it can go back tomorrow to Charlse and go to another person. With wealth, it's even worse. The Gini for wealth for South Africa is 0.93. Meaning that the richest 10 people out of 100 in terms of wealth, the wealthiest South Africans, they are taking nearly everything. They are having everything. All this wealth you see in South Africa is owned by 10 rich people out of 100. So, because of this inequality which has been perpetuated by not necessarily naturally that some people are working so hard, by politics of South Africa. The apartheid policy went, but it was not completely erased out. It actually remained working in South Africa in a way that, you know, Charlse, I've ever told you on this panel here, that there are two ways of getting wealth in the world. Number one, through wealth creation.
Yeah.
Number two, through wealth transfer. You transfer from those others to yourself. And this is what is happening in South Africa. There is a lot of intergenerational kind of inequality perpetuated in the education system. The rich, the children of the rich are getting first-class education. The children of poor, those ones you saw who were looting those things in KwaZulu Natal, they are getting the worst education you can find, even here in the standards, by the standards of Africa. Ugandans go to South Africa to get good education in some of the universities, top universities. We have studied there, master's degrees, PhDs, and so on. Those are for very few South Africans. Most other South Africans have very poor education. You find that kind of mobility is not there. Opportunities are not equalized. Because when you don't give people good education, then you will not have, they will not have any chance of competing, because education is the most well-proven opportunity equalizer in every society. As when, if you want to equalize a society, give them good education. Children, even if they were born in poverty, once they get educated, they will get better. Also, the benefits of growth in South Africa are very disproportionately shared, as I've already indicated. They are going to those who are owning big companies. The president himself is a very wealthy man. He actually made his money as these others went into politics. He was accumulating wealth. And now they have been protecting that class of the wealthy. So that's why you see whenever there is a spark in South Africa, people run to go and attack those who have anything. You have a store, bring it. We also need to survive. They hate the rich in South Africa, unlike in some places which have chosen policies which redistribute. In South Africa, the rich are looked at as the enemy of the people, and because they are very, very few. The other time, you remember that thing you called xenophobia, and I was on Twitter telling people that this is a mistake. For people to think the reason you see South Africans are chasing those non-South Africans is because of xenophobia. No, it is because of economics, which is poor. In South Africa, there are some what we call economic distortions. One of them is the minimum wage, which you want very badly here. South Africa implemented minimum wage since the apartheid time. Minimum wage means what? When they put the minimum that now you are not going to employ someone below 700 rands as a wage per week. That applies to the South Africans, doesn't apply to the foreigners. Me, Ugandan, I can go and I work and they pay me 400 rands. But a South African, you must employ him at that wage. So many of these firms, for the low-skilled jobs, they give them to foreigners, these jobs of sweeping. And South Africans now say, oh, so these people are the ones why we don't get jobs. They come and attack them. But the truth of the matter is the distortion. You create such minimum wage in an economy which is still pre-capitalist. Because even in South Africa, much as it is being put across as the biggest economy, and so you go to South Africa and see, there's no this Juwakali of ours. You can't survive in South Africa if you don't get a job or you have a piece of land to cultivate. And land is also very unfairly distributed. Access to land is for very few people because the multinationals and these other rich individuals have grabbed very large tracts of land. So my conclusion on this, these events could be occurring in South Africa because of that history of apartheid and what also the economy has turned out to be. But to me, I think many other places in Africa, including ours, if they are not very careful, they are heading towards this. Why?
The level of inequality?
Yes. Why? Because we have pursued a lot the neoliberal economic model of
the Bretton Woods.
Yes. Those who have the eyes to see where money is, accumulate. Those who don't have the eyes, die. That's why you hear someone telling you even now, sends you a message, that the money for the vulnerable was wasted. They should have invested it in acquiring a vaccine, because that person is not a vulnerable. He doesn't really understand that in the what we call inclusive development model, you look at how do you maximize the benefit which goes to the least
the least member of the community,
the most disadvantaged member of the community,
in order to lift them. And
absolutely.
But some people say that is socialism.
You know, this is the problem of people thinking that the world is about extremes. One extreme against another extreme. There is capitalism, there is socialism. Me, sometimes when people ask me those things, who are Ramadan, you are an economist, which side are you? I tell them I am a disciple of economics which works. And it is what I've been teaching my students, and it's what I'm preaching always.
Okay.
Economics which ensures that you first of all ensure efficiency in production, but not forgetting also ensuring that equity is catered for. Distribution is important.
Okay.
And this is where South Africa failed.
Okay, Sarah, take it from that. Ramadan started on a sad note, and especially for you and I, to the ears of a lawyer, he made a very terrible statement.
Yes.
When when he said it was a mistake
To
to cause the rule of law to be applied to a former president just because he's a politician. But he ended very well, in my view. What's your thought about the South African case right now, and any lessons for Uganda as we talk?
Yes, Charles, let me first highlight the background to Zuma's, jailing. Some people make it seem like it is the current president jailing Zuma. Zuma set up the Zondo Commission in 2018 when he was president. So it is the Zuma Commission, if we go by regime. Yesterday, during the hearing of the review application, the lawyers for the commission did say that Zuma holds the key to his prison cell. So Zuma set up a commission and chose to undermine his own commission by not appearing before it for 2 years. So you have a case of a leader, or a former leader for that matter, but I think leaders stay leaders whether they're in office or not. A leader undermining a rule of law, undermining courts, undermining judicial power, which I think should be condemned, because nobody is above the law.
Ideally.
Yes. So, but...
That's good.
Charles, we are faced in the trial of former leaders. It is a question between instability or stability for nations and impunity, and you need to strike a balance. That's the only bit I agree with Ramadan, but I do not agree that former leaders should be untouchable, should get away with murder, should not be answerable and accountable for their actions while in office. I think that would be a very wrong narrative. But it is important for the countries to balance the stability question, because nations can go in frame, like we are saying in South Africa. But why has the South African situation gone to where it is? First was, I do follow Zuma on Twitter, and I saw some of the tweets really for 2 years, undermining judiciary, undermining court. Democracy is about respect for the separate arms of government. It's about rule of law. It's about leadership, is about being accountable. So if you want to be a leader, and then tomorrow you don't want to be held accountable, I think such people should not go into leadership. Once you go into leadership, you should know that whatever you do, your acts and omissions can be put on a weighing scale. And I think we shouldn't lose that principle against populism, against hooliganism, to undermine rule of law. But having said that, yes, because what is happening in South Africa is to rally people, because Zuma did rally the people before surrendering himself to prison. So I think, and the same can be said of what happened in the U.S. Capitol attack, that Trump saga. There are many similarities. It is wrong. Having said that, the situation of South Africa has been made worse by the economic effects of COVID. People have been under severe lockdown. Of course, there are inequalities, higher levels of unemployment for the blacks. I think it's at 32%. The land question, when ANC came to power in the post-apartheid era, they've been in power for 27 years. They've never addressed the glaring land question in South Africa. There are no sensible reforms. Ramaphosa tried at the beginning to establish the Land Commission and do some legal reforms, but there have been no land reforms in South Africa. And I think this is a shame for the ANC. The things they stood for in the fight against apartheid, they've not done them for 27 years in power. They've not even attempted to address the key issues that concern the ordinary black people in South Africa. So you can as well term the current political class in South Africa as if some blacks graduated and joined the former whites and apartheid people. Economically, that's what it is. So you have the black people on their own struggling with the effects of COVID. There are people who have been interviewed on why they are rooting, and they said it has nothing to do with Zuma. They also thought it's time to come out and get something to eat. So I
some of the pictures you are seeing there are really from South Africa. You can imagine what's going on.
Yes, but what do we learn from the South African situation, Charles? Is that once you have a sharp divide between the rich and the poor, it is just a matter of time for the nation to go up in flames.
It is a matter of a spark.
Yes. So once we perpetuate inequalities as nations, we watch as the gap between the rich and the poor expands every other day. Just as per our statistics, Charles, 8.3 million people are now in poverty as per the National Household Survey, of the latest national survey by UBOS.
UBOS.
Yes. Out of those people in poverty, there has been debate that only 510 have been earmarked for the relief fund.
For the relief fund.
For the relief. As much as part of the poor have advantage of being farmers and can have a meal.
Most of them.
Yes, but you have the urban poor that have been left out. Yeah. And these people rioting in South Africa, majority are urban poor. So once you have these effects of COVID, even us, we can't say we are far away. Any spark can now lead us to a South African situation. You have people who are in homes, have no food, have no relief, have nothing. If there is chaos, there's a time we are talking with the youth from opposition parties who are normally arrested and asking them why they participate in demonstrations. And one of them said that at times they are hard placed at home. Even they don't have money for landlords. So an arrest is a relief from this economic stress. So people who have nothing to lose cannot do anything. And these are situations that countries should mitigate. But we should not promote or glorify impunity for current leaders in power.
Ramadan, do you think that in our economic model, you drew a worrying picture of saying that even as you see some trend which is not very good? When you gave the example of the person who shared with us the question here that money should not be sent for relief to the vulnerable, but rather for vaccine. Do we have that kind of mitigating policy that you see is really sensible or reasonable enough to begin to reduce some of this inequality? Or is it hard to learn some of these lessons? We stay together, we talk, we share information, we go and study from South Africa, we come back here as graduates, master's holders, PhD holders, many of them from South Africa, but do we really learn from them?
That's a very fundamental question, Charles. Over years, I've built my economic ideology on what I've seen happening around me in this country. I think as a country, we overprofessed the economics of the neoliberal side. We want to build an economy of Uganda in the shadows of the United States of America, where we are more concerned about efficiency and less about equity. And you know, these things are built in, they are choices. They are choices that we make, social choices. Most of our economists and other policy makers have historically gone to the Anglo side to have education, especially college education. We go to the United States, we go to UK. Now, you have told you, recently we have gone a lot to South Africa and so on. And we come back with the same kind of mindset that it doesn't matter as long as the pie is expanding. How you share the pie is not a very important thing. Concentrate on expanding the pie. That's why most of our policies, economic policies, they are interested more in expanding the pie. Growth, you hear all the time, GDP growth. But we don't ask who is growing this pie and for who or for whom. So at the end of the day, you find that we are building a rich economy with the poor people. The GDP keeps on expanding, but the people are not feeling the GDP. Because the policy itself is not well thought out on how it is going to include different groups of people. This is the tragedy of South Africa, the tragedy of many other countries in Africa. But Southern Africa has the unfortunate bit of the history, because South Africa is the most unequal, followed by Namibia, followed by Botswana. All of those are Southern African countries. They are the most unequal countries. Then you bring in Haiti, you bring in Central African Republic, you bring in Zambia. Uganda, our Gini coefficient has increased from 0.36 in 1992 to 0.42. We are becoming more unequal. When I address people, usually I've been talking about my good economist from Nigeria, a guy called Rico, who said that, you know, the poor are not sleeping because they are hungry, and the rich are not sleeping because the poor are awake. So you find the entire country not sleeping. Now, when you see here in Kampala, Wakiso Mukono, everybody now who's building a house, he puts it in a tall perimeter fence. On the fence we put wires. On the wires we put electricity.
Yes.
And you put a card there, danger.
And the cameras.
Then you CCTV. Then you rear dogs. German Shepherd. You put on the door, beware of dogs. You put a big gate. Manned by some two askaris. If you are privileged, they have a gun. If they are not privileged, they have an arrow and a bow. You get it? But with all that security detail, with the doors and the windows having burglary proof, still Ugandans, Kampalans are not sleeping. Because the moment something happens outside, for example, one of the dogs could be playing around and it knocks the car, the alarm goes off. Then you jump out of the bed. They go to the curtain of the window to peep who's touching the car. He realizes it is his dog. Then you try to pull the duvet to sleep. Around 3 a.m., now these days there is some rain. A storm comes and blows the curtains. He sees the curtain is blue. Then you jump out. Who's trying to enter? Whom are we fearing not to sleep? We are fearing because we know out there are so many younger men and women who have been left out. They are unemployed and nobody cares, you know.
Yeah.
Jobs and livelihoods in this country are not something of very important consideration in our policy. The informal economy is not even in the budget. And yet it is the economy which employs 9 out of 10 people who are outside subsistence agriculture. But it is not even in there is no section in the budget that these are the policies which are going to improve the informal economy, which are the livelihoods of people. So, when COVID comes, it wipes them out because they are vulnerable. You wait, you're going to see most of these younger people, now they are not going to have a livelihood after this COVID. And someone somewhere thinks there shouldn't be a policy deliberate to support the institution of these livelihoods and making them better to grow. So that's the economics which doesn't work. And for me, a few years ago, about 5 years ago, I was invited by Frederick Ebert Stiftang of Tanzania to speak to them about a subject which is about the distributive justice. They asked me one question: when does inequality become unfair? Because there is also some fair inequality. If you have,
or realistic,
if you have equalized opportunities,
or reasonable
opportunities. That's why you see even in class, in the best school, you go to Budo. In class you will find one child has scored 90, another one has scored 30. That is fair inequality. Let this one fail and remain in class. They have had equal opportunity. But inequality becomes very unfair if, number one, public attitude towards the poor becomes so condemning to the poor, that the poor are poor because of their own lack of initiative.
because they are lazy.
They are lazy. They do not want to listen, to take advantage of opportunities. I hear so many people talking those things.
True.
Then their inequality
They're
becomes...
not hardworking.
Secondly, when policies become the vehicle of creating the inequality, inequality is inbuilt the policies. Like the case we are watching here of South Africa. The very policies which run South African government, they perpetuate inequality. Stiglitz did a research on inequality around the world and found that in Africa inequality was rising because...
The former World Bank
Yes,
boss.
Joseph Stiglitz, one of the best economists you ever find. He wrote a book on inequality and he did research around, and he found that in Africa we have perpetuated politically driven inequality. We are closing, in other words, those very routes which, escape routes, which we have used to get out of poverty, we close them on others. In land, look at the land reforms here which have failed to get any vote. Because the guys who are sitting in the chambers of parliament, they have already secured their own land. They feel others shouldn't. Look what do things like a lockdown now. Just this lockdown here. Recently I tweeted about it.
Yeah.
That you lock down everybody else, and then the elite, for them they are driving around.
They are moving around.
They go in the park and they have lunch in a restaurant. Now, who will ever get people out of lockdown if the people who are supposed to sit on policy to vote, they are not under lockdown? If it is lockdown, let everybody be in lockdown. You get it? So, when you perpetuate such policy inbuilt unfairness, then it will perpetuate it. Number three, you find that society can turn aristocratic, where you find nobody designs a policy that can distribute wealth from those who have just inherited it. When you allow people to enjoy bequests as if they are the ones who created them fully, then you are going to perpetuate what we call intergenerational inequality. You know, the richest man, Warren Buffett, is the one who put it better.
He's no longer the richest. He's now number 5 or 6.
One of the richest. That's what I mean. He's one of the richest people in the world.
True.
He said that aristocratic inequality is perpetuated almost in a way that you can make a policy that those who are going to participate in the Olympics of 2021 should be the sons, the eldest sons of the Olympic medalists of 2000. You get it? There you have just right away created inequality.
Yeah.
And this is what is happening in the world today. The policy makers also are relying more on statistics other than on the ground realities. You rely there, you are going to create inequality which is unfair. You come and tell people that according to the Gini coefficient, Uganda is okay. According to the poverty numbers, poverty has reduced in Uganda. But what about the on-the-ground realities? What do they show? These are some of the things we need to look into and address. So, I know I could go on and on, but what I mean is this. As a country called Uganda, the economic model we adopted to take Uganda to the promised land, these days our promised land is middle income status. that model is faulty.
Okay.
Uganda is going to get oil money, for example. A few years from now, we shall have oil money. And they will declare Uganda middle income because they will get GDP and divide by the number of people in Uganda. So but when that money...
Dividing our poverty plus the riches of other people and then saying that we are all rich.
Yes, when the richest man in Uganda gets richer, they will say that you have gotten now to middle income. So this model is faulty. We need to revise it. We need policies which are creating jobs and livelihoods for especially younger people, whom Ugandans have produced in very big numbers. Okay. If we don't,
I want to, thanks a lot, Gobi. I want to read and then I come back to Sarah. I think the discussion is getting more interesting. We have other topics, main trending topics of the week, but it appears this South African thing and the lessons for our own country, we are all in Africa, is a big one that we cannot take for granted, and people are really joining in the discussion. I've seen someone called Igumira John, sir. He says, Charles, thanks for the show. His take is a little different from yours, Ramadan. He says Zuma is not the first president to be a corrupt leader in the history of South Africa. The decision taken by South Africa government is deplorable and regrettable. Why didn't they set the example starting with De Klerk? Is it because he was white? Wasn't a precedent made then? His corruption was also laced with grave violation of human rights. Until we diagnose our societal problems with the ideological tools of analysis, Africa will remain slumberland or dormancy. Thank you, sir. And he says he's called Sir John Igumira Ramasindi. Another person here called John says the imprisonment of Zuma was not well thought out, the legalese notwithstanding. Okay, this person does not believe in what Sarah and I have been arguing.
Even the first one.
But you see, that's another shocking thing, because you see, we say the law must be blind to favoritism and to, you know, any of these other dynamics. But people argue when, you know, circumstantially,
the law should be blind.
That, yes, positivism argues that way. But Sarah will bring us back into that. But the person says the imprisonment of Zuma was not well thought out, the legalese notwithstanding. Mandela didn't jail de Klerk when he had heaps of evidence against him. President Ramaphosa, the name is actually Ramaphosa.
Okay.
The pronunciation.
the way it is pronounced. President Ramaphosa has skeletons in his closet that could send him to jail when he leaves power. But what's happening in South Africa today has helped him, because the next president will have learned from today's lessons. This is John Santos. Another person here says, I'm so loving your show today. This is Patrick. Ask, you know, Ramadan. He sent some questions, and he says, why didn't you invite Besige on this to discuss with Ramadan, something like that. We shall definitely reach out to him. Another person here, another viewer called E. Batamba. Batamba says, let me see. His message is very long. What to do is to legislate that a head of state should face the law when still in power. Batamba, I don't know whether there is any country with that kind of law. I have seen the Kenyan one, the Ugandan one, the South African one. There is a reason, even the American one, there is a reason. In fact, for the Americans, like you said, protects even former presidents. And there is a reason why they do that. If you go into constitutionalism and studying different legal philosophies, you understand and you will appreciate why that is put in place, because presidents represent the state, the nation, and they carry so many things on their shoulders. So just imagine your president was just picked from anywhere just because he has, and the belief in law is that their decisions, you know, you have to protect them in order to make decisions that guarantee the governance of their country. It is not just about them being above the law. It's not that. And unfortunately, it is something we cannot exhaust discussing here. Sarah, I would have given it for you, but I don't want us to go legalese because it's interesting, I know, especially when you give examples, but can be a very long, boring thing to many people. And another viewer here, people are so interested in this. Another viewer here says, let me see who this is. This is Kerry Ellison from, and he says, Charles, thanks for the show. My alarm is saying that President Museveni is not going to sign the 20% NSSF bill. We have lost jobs. Honorable Nabanja list, we cannot be recognized on it. Please raise the issue in this discussion. We are soon becoming cannibals. And a number of staff have been laid off, especially in corporate banks, telecoms, but the government has offered nothing like stimulus package or paying 20% NSSF to savers. I want to hear from Mr. Gobi. The person is calling that. And then our friend, a fellow Ugandan, Justus Muhanji, but who lives in Sierra Leone and watches this program a lot, says, Charles, thanks for the show. Because of delayed traffic, I joined the program late. Security and white people in South Africa have killed over 80 black people, but the world over is quiet. We are not quiet. We are discussing justice. In Uganda, 50 people died, all over the world all over condemned. Racism is extremely high, and white people still control South Africa. That's the inequality both of you were talking about. Here in Sierra Leone, I entered the restaurant 2 years back, but I was denied food because I am black. Is Uganda ready to reopen when people are not vaccinated and hospitals still suffer lack of oxygen and cylinders? Then Twesije from Rwampara says, I'm watching from Rwampara. Good evening, Charles. Gobi is at his best today. He has given beautiful facts, but the things that ladies are looting in South Africa are very interesting. The comments can cause some laughter, but you see, this is not something to really laugh about. It's sad when you look at the videos, how it is happening. It looks really sad, especially that picture of, did you see that picture of the child being thrown from the balcony up, you know, and into the arms safely, thank God, safely into the hands of a number of people who were waiting to hold. And I think the mother or someone taking care of the child had been trapped and didn't find a way down. It's so sad. It's so sad. Officer Dible says, this is called Officer Dible Francis. He says, I recall the proposal to employ the rich people's children as a way of saving the country from corruption. This could be a potential injustice that could possibly happen, as Ramadan has put it. Good policies must be from the ground, not from the boardroom. OTT failed because of that. And then someone here called Maxon Muezi. Muezi says, Charles, politics hovers over the law. Whatever is being done in South Africa only disturbs the peace of the late Nelson Mandela. We pray that God intervenes in Mozambique, Nigeria, Ethiopia, Somalia, and Congo. For sure, that's not what ANC fought for. I agree with you, especially knowing that as a country, Uganda sacrificed a lot to see that that country gains its freedom. And then there is someone called Moses. Moses says, greetings, Charles. Wonderful discussion. I can't agree more with Musomesa Ramadan and Council Birete on the economics which doesn't work. My question to Ramadan is, can market economics deliver quality? I doubt. What's the alternative though? And then let me see the number of other questions that have come here. Let me read this. I saw some messages. Oh, they were. Nixon says Uganda is very close to South Africa in terms of regional inequality. How? That's what Nixon is saying. And then someone called, this person has not put his name, but he says, it seems violence in South Africa is in their DNA, probably because of their violent history. It seems the looting is not about those who have nothing to lose. There are videos of those arriving in posh cars to load their loots. Yes, some of the things you say here, in my view, you're right, but I think it's judgmental to say a sweeping statement, to make a sweeping statement like saying it seems violence is in the DNA of South Africa. I think that's not entirely true, but you have your opinion. Then there is a message which is very long. I cannot read it. It's so long from someone here. I won't read it. This is too long to read. Keep it short so that I won't read this one, so that next time you participate, you can send a message which is shorter. This one says, Charles, good evening. I am Erica watching from a patch here. My request is always let Ramadan lecture us enough. Please have a blessed night. No, here is not for lecturing. Here is for a discussion. And we have to.
Don't lecture here.
No, what he's saying, I think he's enjoying the discussion today. So he's saying he would want more of it. I think that's how I got it. I tend to get the positive side of the, yeah, of the message. But Sarah, you have had some of the questions and comments coming from our viewers. We are now left with about 3 minutes to midnight when we should be closing. Sarah, now I'll give you 2 minutes and then Ramadan only 1 because he had used more time.
Yeah.
Sarah, your comment to the questions that have been raised, generally your response, but also what you think in terms of, you know, going forward. There are stark, you know, similarities between our countries. South Africa and Uganda, like Gobi, like yourself, has noticed that there is growing inequality and the class differences and all that, and also a tendency for the young people, especially for various reasons. Some of them, of course, huge unemployment, to the radicalism, that attitude of radicalism. How do we make sure we mitigate those kind of things so that it doesn't lead to the kind of destruction we are seeing on the screen down South Africa?
Okay, briefly, I will talk about the nature of Zuma's arrest briefly, the few legal issues really. An offense of contempt of court normally does not carry an option of a fine.
You go to jail.
Yes. In Uganda specifically, there is no option of a fine to contempt of court. It is strict in nature.
Yeah.
I don't know the specifics of South Africa, but it could be the same since we are a common law country.
Commonwealth
Yes.
jurisdiction.
Yes. So it might be that there was no option of a fine, no option of house arrest,
But
no
you
option
can appeal it.
There is a review.
Yeah.
There is a review application and the courts will rule. They had the
Except
case
that for him, he refused to appear before it.
for 2 years. Not just a short time. You know, people make it seem as if the world is unfair to Zuma. 2 years, a leader. There is no leader worth their name that should abuse court processes.
And by the way, sorry to interrupt you. I actually missed coming with a clip. My brother actually was reminding me. He watched Zuma when he had come to power. He was the one who said, we are building a culture of constitutionalism, and we must never have in South Africa, Zuma himself,
Yes.
that we must never have in South Africa a situation where the law only serves the interest of the powerful, whoever you are. I wish I had got it and play it here. He's the one who said
And
it.
that is the spirit of South Africa's constitutional court, which is the most powerful constitutional court in Africa. Which is the most constitutional court in Africa. Very powerful. People are saying, why can't Ramaphosa get... Now, do you give somebody a presidential pardon over a contempt of court? Then what will happen if they are guilty of corruption? the real charge that they are faced with. But where the situation has reached now, it is a question of stability. It is beyond Zuma. So South Africa and the ANC leadership have to look at how to salvage the nation. People are dying, people are rooting, businesses are up in flames. So the political question now has to come in. How it comes in, we will watch that as it happens. But it is no longer the legal, it is no longer about Zuma, it is now about South Africa, it's about the economy, it's about livelihood, children falling off burning buildings. So it's beyond Zuma and the courts. Away from that, I want to underscore the fact that it's not only Zuma that has been tried in Africa. Charles Taylor was at The Hague. Other presidents have faced the regional tribunals. Bashir is at ICC. So, impunity should not be tolerated. Really, that's the principle. And leaders should be held accountable for their actions. Just a comparison with France. France did try Jacques Chirac for corruption. And now Nicolas Sarkozy has been sentenced 3 years for corruption over illegal campaign financing. So it is not witch hunt. If you have systems, if you have independent governance institutions, it should be normal for a leader to be called to account for their actions or omissions while in office. What do we need to do as Uganda? Just, Charles, the period we are in and the talk of relief and Nabanja money. I was just looking at, I think, as of today, about 200,000 have received their money, at least as per the statement, the latest statement from the Prime Minister. But when you look at the trends of people scheduled to receive money, majority of them are from Central and then the West. Whereas for Central, it is understandable because of the urban nature of most of the central parts of the Central region. But we know that the North and the East have the highest poverty levels in this country. But they are also the least beneficiaries of COVID funds. As much as we might not relate directly poverty and vulnerability because of COVID, because the government said they are looking at people who have immediately lost incomes or jobs because of lockdown. That's what they are considering as vulnerable. But we know that I've seen statistics, Ramadan will tell us, the new poor, the immediate poor, you know, you have seen, and then the floating class as per middle income, where 61% of the so-called middle income in Uganda, the floating class, which can immediately slip back into
poverty.
Yes. So when you have this level of a fragile economy, and then the policies that we do, where, for example, majority of what we talk about as fiscal policy normally touches on the lives of people in the money economy. It leaves out to the 34% outside the money economy. And Ramadan has said we never budget for the informal sector and how to make it formal and the rest. So when you have this entrenched inequality in our policies, look at, for example, the land evictions in this country. Who are the affected people?
The poor.
All the work that we do for social justice is really to salvage the dignity of poor and vulnerable people against the rich and mighty that are protected by police, that are protected by courts, that can access justice, that can bribe for court orders, and when they evict 600,000 like we saw in Wexo recently by Chonjo. So this is the entrenched inequality that can easily, you know, that a nation can easily slip into frames if the leadership does not take particular interest in reversing the trends.
Okay, Ramadan, I need you to close in 1 minute. Someone says, Ivan Okuda says, please help ask Odongotho about a book that Ramadan Gobi talked about on his show written by Stephen. No, it was Stiglitz. He talked about Joseph Stiglitz, the World Bank. Stiglitz was the World Bank actually president.
Economist.
Yes, but he is a non-economist. It is not Stephen, but it is Stiglitz Joseph. He came to Uganda, I think.
Yes,
he came to
yes.
Uganda.
That's a wonderful lecture.
Yes, he came to Uganda and made
the
a
same
lecture.
issues.
Yeah. I think he's the one who used to talk a lot about debt not helping Africa.
And the liberalization.
Exactly. But you can now make your final points,
In
Ramadan.
1 minute.
Yeah.
Wonderful. Number one, there is a gentleman who talked about the market economics being a problem. Market economics is actually the economics that works. Only that markets also fail. They fail by colluding. You know, when you leave market players, they can collude to charge very high prices. Sometimes markets can be missing. Like now we have a missing market of ICUs. So if you left the market to provide ICUs, you might never have ICUs and ventilators. Then it can fail in predation, where financial institutions set people into traps to take their collateral. They give you money and you fail to pay, they take the collateral. So because of that, regulation is always important. And in Uganda, we have failed on this. Where we attempt to regulate, we go into what we call regulatory capture. The people who are playing in the same industry are picked to be regulators. You can't regulate yourself. We have also the challenge of redistribution. We are not deliberate in redistribution. Although, on issues of education, the universal primary education is a fantastic idea. We just need to build it more, ensure that the quality of UPE improves. That will, in the future, is going to bring the opportunity equalizer in Uganda. Finally, I want to say that all these issues we are discussing, they are a matter of social choice. Countries which are equal, countries which have built economies that are working for majority of their people, they made a choice early enough to build those economies that way by using an inclusive development model as opposed to the neoliberal model. And good education has always been the anchor, the pebble upon which what we call fairness is provided in a society. When you give people good education equally amongst all classes of people, you have almost halfway solved the problem of inequality. The final one is on the economic policy. In Africa here we have a challenge in our tax policy. We are taxing the poor to compensate the rich. You tax the poor through VAT and other taxes, and you give the rich tax holiday, in the sense that they are going to build more investment and employ the poor. But you don't have control over repatriation of their profits, on how they are going to spend their dividends. So this is something which Africa needs to devise. IMF has always carried out these studies amongst the rich multinationals and others. They tell you what takes us to countries to invest in those countries is not tax holiday. It is the business environment. You better invest more in improving the business environment than perpetuating inequality by taxing the poor, and you compensate the rich.
Thank you so much, Gobi. Someone called Seith Nyesiga Bwerere says, Charles, I agree with Council Sarah Brete. Every leader that embezzles taxpayers' money should really pay for his or her crimes. So, to me, Zuma deserves it. Thank you very much. And we didn't discuss the relief of 100,000 sent to the vulnerable, but I'm sure that my good friend Honorable Nabanja is watching, and we are expecting you on this show one of these days, Honorable, to discuss this and other issues. But when you come, we need you to also tell the Ugandans, especially the east and north that Sarah has talked about, why they have fewer people who are on the list of beneficiaries for the COVID, when, according to the government's own statistics from UBOS, the poorest in the country are from those two regions. It's something that you need to think about as government, and Parliament needs to take notice of that and see how to balance that. It's not the best when, but otherwise the book of Stiglitz is called The Price of Inequality. That's Ivan, if your friend was asking about Stiglitz's book, it's The Price of Inequality, and it's by Joseph Stiglitz, the former World Bank president. Thanks so much to you out there. Thanks for our viewers. Thanks so much to my technical team, Margaret, Ivan, and Sekabira, and the rest of the team, and to the producers, Fred, Bills, Morris and William, all the rest of the team, the entire team that helps me to put together this show. Thank you so much. And to Uganda out there, COVID is still real. Don't drop your gun. Don't ever drop down your masks. Wear them, continue social distancing, and keep away from people. Try as much as possible to wash your hands with clean water and soap, and if possible, always ensure that you don't get COVID. But even when you get it, try as much as possible to report it early enough so that it doesn't become destructive. We can beat COVID, we can live with it as a society, but we just have to learn how to live with it. Otherwise, it's still deadly, it's killing. We say pole sana to those we have lost. Otherwise, good night, bye-bye. God bless Uganda, God bless all of you.